Good afternoon, ladies and gentlemen. Please join me and raise your hand if you've ever taken a drug that didn't quite work for you. If you've ever taken a drug that actually made you feel worse rather than better. And have you ever had a loved one actually be told that there's no effective treatment for their condition? Well, for all of you, the many of you who said yes, unfortunately, you're not alone. There's thousands of people who die every year because of adverse drug reactions. There's millions of people who suffer from taking the wrong or ineffective drugs, prescriptions. About half the drugs available out there will only be effective in 50% of us in this room and out there in the world. And how much does this cost to our healthcare system? Billions, over $100 billion are spent every year to combat the adverse drug reactions of the drugs we give, not because of the disease the patients are suffering from. But don't take me wrong, I'm all for drugs. I very much believe in them. They have significantly improved the quality of our life. They have helped us fight disease. Together with changes in our lifestyle over the last century, they've helped us increase life expectancy by 30 years. So drugs are really serving us a great purpose, but they're far from ideal. And we have to find ways to make better use of the drugs we have and generate even better drugs. So why do we respond differently to drugs? Why do some benefit where others don't? Why some benefit when others are harmed? What is it that makes us different in that respect? Well, some people try to find answers in their environment, their diet, their lifestyle, the moon and the stars. Personally, I've always been fascinated by what lies within us, in our very own DNA. What answers can we find there? So let's take a trip for a few minutes inside our body. We're made up of over 100 trillion cells. Inside every single one of these cells lies our DNA, 2 meters long, tightly packed in every cell. This long string contains different regions, called genes. We have 20,000 genes as humans, in every single cell. It is these genes that determine the way we look, the way we function, the way we interact, respond to our environment, our predisposition to diseases, and sometimes, as it turns out, to the way we respond to drugs. So there's a new field that's now evolving quite rapidly called pharmacogenomics. Pharmaco from the Greek word drugs, and genomics because it evaluates our entire genome, our whole DNA, in order to identify those parts of it, those parts of our genome that affect the way we respond to drugs. And what is pharmacogenomics promising to deliver to you one day? Personalized and targeted treatments. And let's explore what this may mean. What are personalized treatments, and why could this benefit you? Well, a personalized treatment is a treatment that is selected after you've done a genetic test. Not any genetic test, a genetic test that will help you predict, help your doctor predict, if the drug you are about to take will be safe and effective but unsafe for you, maybe ineffective but safe, or worst case scenario, unsafe and ineffective. Developing such a genetic test would allow you to take only those drugs that would work best for you from the drugs we have available. Let's look at some examples from the clinical practice today. One of them would be for how we can use pharmacogenomic tests to avoid adverse drug reactions, and it comes from the field of AIDS. An anti-HIV treatment, abacavir, can cause, in a small percentage of the population, about 5% of Caucasians, it can cause a severe hypersensitivity reaction that can prove lethal for these people. However, abacavir is an important drug. We want to have it available, we want to be able to use it, but we want to be able to use it safely. Can we predict who is at risk before we go ahead and give them the drug and risk their lives? Well, yes, now we can. Pharmacogenomics has been able to determine which gene in our genome, and furthermore, what kind of variation in this gene is responsible for this severe hypersensitivity reaction. So what can we do now? Before administering this drug in the clinic, have a genetic test that will determine if a person is a carrier for this variation in their DNA. If they are, they shouldn't take this drug at all. They should choose another one. If they're not a carrier of this variation, they can go right ahead. And another example, how can we use such genetic tests to improve the effectiveness of the medications that we're using? Make sure that we use the most effective possible medication for the specific patient, for each patient. And here's an example from breast cancer. We heard this morning from Dr. Markopoulos how common this disease unfortunately is, all over the world and in Greece in specific. He said there's one woman that is diagnosed every working hour in this country alone. It's a huge problem. We need to have effective treatments to combat it. So breast cancer, you're probably well aware that we have cases with metastases or cases who do not present metastases. In those cases who do present with metastases, we have two subgroups, those who are responsive to a treatment called trastuzumab, an effective treatment in general, and those who are not responsive to trastuzumab. But how can we predict ahead of time who's going to respond and who won't? Because with cancer, you really can't afford to waste any time. You have to choose the best treatment right from the start to stop the tumor from progressing. And what did pharmacogenomics do for us here? Well, develop a test that screens for the expression levels of a gene called HER2. Apparently, as it turns out, in those tumors that have high expression levels of this very gene are responsive to trastuzumab. Therefore, performing such a test before deciding on the treatment, before starting the therapy, can save time, can save trouble, and can definitely increase effectiveness. And what about the next step? Can we actually achieve pre-symptomatic treatments? Being able to predict that a patient will develop certain symptoms or conditions and treat them ahead of time. And here I'd like to talk to you a little bit about what it is that we do in our research team here in Athens. We have been focusing over the last 10 years in dilated cardiomyopathy. Dilated cardiomyopathy is a severe form of heart disease that progresses to heart failure. As it turns out, a subgroup of these patients, in addition to the cardiomyopathy, they will present with arrhythmias, sometimes malignant arrhythmias that can lead to sudden cardiac death. The question for us was, can we predict which ones of our patients are likely to develop arrhythmias, and can we find ways to prevent this before it happens? The problem is, you have cells with 20,000 genes and hundreds of thousands, maybe over 1 million different proteins. Where do you start? So, we followed the advice that was mentioned earlier by Dr. Boussias, not thinking outside the box, but rather thinking inside the triangle. Zooming in and trying to find out the very core of the problem and try to work our way from the center to prediction. We looked into the cells of the heart, and what you're seeing here is a cardiomyocyte, a cell from the heart. You're seeing the sarcomeres, those contractile units that allow the heart to contract and relax on a beat-to-beat basis. But what is it that the heart needs in order to do this? Among the many things it does need is calcium ions. You need the cell to have high concentrations of calcium ions so that it can contract. But for it to relax, the calcium needs to go away, back into a storage space. It needs to be stored there so that the heart can relax for those few seconds and be able to contract again when the calcium is released into the cytoplasm, the space inside the cell. And then we went into that storage space and thought, okay, this is really important. The release and uptake of calcium ions. Which molecules are involved in this process and how do they do it? Through this work, through extensive work with different molecules, we discovered one called HRC, the first molecule to be discovered to allow the communication between the complex that's responsible for calcium uptake with the complex that's responsible for calcium release. So if you want, it's a messenger inside this storage space, a messenger that allows the communication between the different sections of the storage room in order for the calcium ions to be released at the right amount at the right time. So we thought, well, this messenger must be really important for the cell. If there were variations in it, the patient could potentially have complications. So let's go ahead and screen patients with dilated cardiomyopathy and see if they have any differences compared to the normal population. So we went in and screened the HRC gene for hundreds of Greek people. And then we went on to start an international investigation, recruiting hundreds of patients from all over Europe. And indeed, through luck and hard work, we came up with a variation in this gene, a very common variation. A variation that's present in about 30% of us in here. On a healthy background, in a healthy person, it won't cause any problem at all. But if you happen to develop, for whatever reason, dilated cardiomyopathy, and you're carrying this variation, then you're at a high risk to develop arrhythmias and risk sudden cardiac death. So being able to do such a test in patients with dilated cardiomyopathy would allow their doctor to know ahead of time if they are at risk and take the necessary steps to prevent it, or if it happens, to make sure that it's not as severe. And I mentioned earlier the word targeted. What does targeted mean? Well, targeted is trying to identify the very core of the problem, as I just mentioned, and developing ways to target that for treatment. You may be surprised to know, if you don't already do, that most of the drugs we have available out there, as great as they are, they're often the outcome of serendipitous discoveries. They work, we use them, but we don't know exactly what it is that they do in our cells. How do they affect the way our cells, our heart for example, works? The exact molecular pathways. If you want to solve a problem, many people feel you have to find what's the source of the problem. You have to go to the heart of the problem. So in our lab, one of the other things that we have been working on is trying to fix broken hearts. So we go back into the heart, into the different parts of it, the tissue, the cells, yet again, and back to our favorite, storage space for calcium. I mentioned earlier that there are proteins, protein complexes responsible for the uptake of calcium into that storage space so that the heart can relax every time, after every beat. We knew that there are two key proteins involved in that process, SERCA2a and PLN, for phospholamban. However, our question was, can these two proteins alone do all the work, or are there more proteins involved in this process? And you may wonder, well, why do you care? They're just proteins. Well, if you want to solve a problem, you have to find where it starts. And if you find where it starts, you have to target the start, rather than trying to fix all the downstream problems. So through a lot of hard work, years worth of work, and a whole team in our lab, we were able to discover multiple other proteins, as you're seeing here with the different colors, that are involved in this process. Proteins that interact with each other under different conditions, in different ways, proteins that are crucial for normal cardiac function, but even more importantly, they behave abnormally in the pathological setting when we have a heart disease. Their expression may change, their activation may change. Sometimes the patients may carry variations, mutations in the genes responsible for those proteins. So the idea now, and our efforts now, are going into determining how we can actually amend those problems when they occur. How can we target these protein complexes and ensure a better outcome? And I'll move on now to another example from targeted treatments that have translated to the clinic and are being used. And this is an example from the cancer field, lung cancer in specific, and a subgroup of lung cancer patients, an example of a targeted and personalized treatment. You may have heard there's two drugs, gefitinib and erlotinib, that are effective against a specific form of lung cancer, but the catch is they're only effective in 10% of the Caucasian population. The rest 90% won't benefit at all. This 10% will benefit greatly. The question is, how can you know ahead of time? And why is it that only some benefit, but many others don't? Because these two drugs have been designed to target a very specific pathway, the EGFR pathway, that is crucial for the life of a cancer cell. But these drugs are only effective when they bind to the mutant protein. This means that you need to have a variant in this gene, a mutation in this gene in the tumor cells. With pharmacogenomics, you can now run such a test, determine if there is a mutation in the tumor DNA, and if there is, you can go right ahead and use this treatment. If there isn't a mutation, you really shouldn't waste time. Go right ahead and find another medication that will be effective to those patients. So, ladies and gentlemen, there's many, many more examples from our work and all over the world I could be talking to you about. Unlocking the human genome really gives us a broad range of new tools for combating disease, for making better use of our drugs, and developing even more improved new generations of drugs. If I was to leave you with a question and a thought, and with all the ethical questions this may raise, can you really imagine the near future where our smartphones, our cell phones, would not only be our personal assistance tools, not only have your contacts, your calendars, your maps, your recipes, what if they were also your medical assistance tools, containing your unique DNA information, not all of it, just the necessary one, so that your doctor would be able to know what is your unique genome and therefore tailor your treatment to your very own, your personal needs. Thank you.